Hello and welcome to today's episode of Health University, where we talk all things women's reproductive health with a focus on fertility and fertile health. And I'm so excited to have this conversation today because it's a critical one. It's about affordable advanced reproductive therapies, including IVF. We know that IVF is so expensive, and even though many companies are now, or many states are even now requiring some compensation, it oftentimes isn't enough to even cover one cycle. And depending upon the woman's needs, she can need up to 3 cycles. But we have options, and especially for those who may not need to go through the full run of IVF. And so today I'm excited to bring to you Georgia Nunan, who's going to talk about affordable IVF through Open Fertility. Open Fertility is a new center that is affiliated with Spring Fertility. And I'm going to turn my head now to read the bio because I don't want to miss anything, Georgia. Georgia Nunan is a board-certified women's health nurse practitioner and lead advanced practice provider at Open Fertility, where she helps bring high-quality, affordable IVF and egg freezing care to patients in the greater Sacramento area. And frankly, they can come in from anywhere in California if they can make their way to Sacramento. With a background in midwifery, labor and delivery, and reproductive endocrinology, Georgia brings a deep, holistic, and patient-centered lens to fertility care. She's especially passionate about meeting people where they are. And boy, if anyone needs to be met where they are, it is the person struggling with fertility, blending evidence-based medicine with whole being support. At Open Fertility, she's played a central role in developing the clinic's accessible integrative care model, one that partners closely with other providers, like myself, to support the full mind-body experience of fertility. So, Georgia, welcome and thank you for being here today. This is, as I said, possibly one of the most important conversations we need to have in the field of reproductive endocrinology today.
I agree. Thank you so much for having me, Susan. Honestly, just having the opportunity to share this space and be able to talk with a provider of your caliber and what you are bringing to the table, I think that they go hand in hand. I think that that's where the direction of fertility care needs to go.
Mhm.
This true collaborative team addressing every aspect of an individual's care to have the best outcomes.
Yeah, the
Thank
best
you so
outcomes.
much
Yeah.
for
And
having
the
me.
best outcomes are not necessarily just that, how many eggs you are retrieved or how many embryos are frozen or eggs frozen. It's the whole person's experience. So I'm really happy to dive in here. Tell me about how open fertility, how did this come about?
Yeah.
I always love an
So
origin story.
yes, so this is a passion of mine has been. I've worked in reproductive endocrinology now for a little over 4 years. I was at another more traditional model before moving over to open fertility. And something that I noticed as I attained my experience, my training, because it really is such a specialized field, but I also noticed what kinds of people can actually afford IVF and egg freezing. And that didn't feel okay for me. And so, as a true advocate for justice, reproductive rights, all of that, there was a disalignment. And so, the founders of Open Fertility, the beautiful minds behind its inception, also agreed that only 20% of people being able to afford the care that they need to achieve the birthright of children in their
Mhm.
life. Only 20%, that's not okay, not enough. And of course, as you mentioned, the legislation that's coming about is really, really reassuring and hopeful, but some people can't wait for that. And
And many people can't wait for that. Anybody who's probably listening to this podcast is in that category of, I can't wait for that because it could take years.
exactly, exactly. And it's not okay for them to just be continuing. I mean, most of these people want a baby yesterday. And so 2026, 2027, maybe possibly having, and depending on the company that you work with and how many employees that they have and what kind of treatments need to be checked off before they can get to that IVF cycle, if that's the treatment that they need, it's just not enough. And so again, the minds behind Open decided to create this new model. And what we're trying to do is, of course, address the inadequacies of the fragmented care or just feeling like a number in these more high volume or traditional IVF clinic settings. So, of course, addressing like that personal approach, really having an integrative approach. being able to work with our counterparts, such as our lovely Dr. Susan Fox here, and really incorporating that, not just shuffling you through, but really integrating all of that, but then still addressing the other accessibility issues of dropping that cost so that you can prepare for that. Because I mean, again, sometimes $30,000 to $35,000 for an IVF cycle, it's just an unimaginable feat.
Right.
I went through IVF myself,
Mm-hmm.
and luckily my partner and I had a wonderful family that was in the position to be able to help us.
Mm-hmm.
But like if we didn't have that help, we wouldn't have created my daughter,
Yeah.
right? And so it's not okay.
Yeah.
We have to address that. And so
Yeah. And you say 30 to 35, but that's a single IVF. And the
exactly.
statistics show that often up to 3 retrieval cycles are required to bank enough embryos to, I'm going to say assure, but of course that's in air quotes because nothing is assured, the probability of a live birth. So,
Yeah.
yeah, reducing that cost is so imperative.
Mhm.
However, it's possible. It may not be available for everyone. I mean, not be appropriate for everyone. So we're going to do a little bit of a deeper dive in that. But start with telling like who is the right person for open fertility? What would that person look like, and what would her health history look like?
Yeah. Thank you for saying that.
And forgive my pronouns. My daughter's always correcting me. What would they look
Yeah.
like?
Yeah. Thank you. Thank you for addressing that too. So I think it's a little bit easier to talk about maybe who wouldn't be maybe
Okay.
appropriate. Again, our goal is to make sure that the person is getting the care that they need to
Mhm.
reach their goal the fastest.
Yeah.
And we can work with a huge, broad range of people with different health history, different treatment goals. Um, but the people that we would maybe refer to a clinic that is able to take on really, really, really complex cases, or someone that's failed a number of IVF cycles.
Mhm.
And I say that with like a disclaimer, meaning like we review prior records and
Mhm.
we really see if it's appropriate. Like maybe it was a protocol error. This person only got 4 eggs, but we could have gotten more eggs at that
Mhm.
time if there was a different protocol approach.
Gotcha. So I wanted to highlight that
Mhm.
failed prior failed IVF cycles is not a rule out for
Yes.
the possibility of a low cost IVF cycle through open. Okay.
Exactly. And that it really means that there might be a little bit more of a hold just for us to review the records, myself and our medical director,
Mhm.
going through and making sure that you are finding yourself in the right place. If it
Mhm.
looks like you might need some of the enhanced treatments, I don't want to say add-ons because that sounds so terrible, but the
Yeah.
things that are done in the lab that a more traditional IVF setting is doing, and we'll talk through the things that we're able to
Okay.
achieve.
Yeah,
If
this is a good
we
segue. If you don't mind,
Mhm.
then what would be a good example of a typical patient journey
Yes.
when that
Yeah,
person arrives at open fertility?
course. So we have online booking again, which is like very exciting for me because I think that it's an old school of thought that you need to have a referral from an OBGYN after you've met this many months of
Mhm.
not getting pregnant. And that's just not, it's as soon as you're thinking about your fertility or the possibility of babies on the horizon, maybe not even this year, but in the future, and
Mhm.
you're like, I just have this feeling. And I'm a firm believer in trusting intuition and your body
Absolutely.
intuition. And, people that have uteruses and ovaries and their connection to their body. And just, I have so many patients who come to me and say, I've just always known that there was something off. And
Hmm.
my well-intentioned OBGYN was saying, no, don't worry about that heavy period, those irregular cycles, let's put you on it, and not really assessing or finding the root cause
Yes.
of that
Which
and
then
being
appears once you go off birth control because you want to conceive.
exactly.
Right, right. It's a wonderful, I mean, I don't want to dismiss
Yeah.
uh, oral contraceptives or any contraceptives as something to mitigate,
Mhm.
it's discomforting signs and symptoms. But
Mhm.
please, listeners, viewers, know that that's not the remedy. I'm going to call it Band-Aid, but I don't mean to sound like I'm being dismissive of it.
Mhm.
But that the problem that caused these signs and symptoms will reappear once you stop the intervention.
Exactly. It's like
Yeah.
addressing an annoying symptom. I never know when my period's going to come and I just start bleeding and I bleed through my clothes. I need something to regulate this.
Mhm.
And it's wonderful for that and
Mhm.
contraception, of course.
Mhm.
But what is the root cause of that? What is the reason that you're having unpredictable cycles? And so if you've ever had in the back of your mind, like, I just wonder what that something told me that wasn't okay, or
Yeah.
there was a reason behind that, that's when you should reach out and just connect. Go to one of our webinars to start learning more about we have free webinars every month,
Fantastic.
just getting that introduction, starting to interact with that information that will inform and empower you to make certain decisions that will ultimately could change your life. And
Mhm.
so they can go online, schedule a new patient appointment on their own.
Anyone at any time. So
Yeah,
there's no referral required.
exactly.
Great.
And our new patient appointment is a little bit more approachable in terms of what we've seen in other clinics. It's $195. That includes an hour to an hour and a half consult 101 conversation with
Wow.
me.
That's amazing.
Yeah, and just really finding out their story, their goals, what evaluation, if any, has been done, how we can incorporate that, what their support team looks like, and how we can really call on everyone in their corner to really navigate this next step. If you kind of are coming as like, I'm just wanting an evaluation to get more information, it will be doing an ultrasound. We get to look kind of like a tour of your anatomy. It's really cool. I totally can geek and nerd out on just being able to be like, oh, those are my ovaries and
Yes.
there are my follicles with my little eggs. And
Yes.
what is the cohort that's being released on a month-to-month basis? And there's my beautiful uterus. And I'll get compliments I never knew were so wonderful about my lining, or and just being able to see the shape of I mean, all of this is fascinating. And so all of that is included. We can start lab work that day. It's really informing what each decision point or which diagnostic tool can offer that patient and letting them tell me what feels comfortable for
I
them to
just
get.
want to highlight again. So for $195, you get a 1 hour consult and an ultrasound with an antral follicle count and a state of the uterus. Um, People, that's amazing. That's beyond low cost. So, if you are just at all even mildly curious about the state of your fertility, like I would say run, don't walk. Because
Yeah,
it's
thank
such so
you.
important to have that baseline even.
Right. Yeah, no, I
Yeah.
completely agree. And I
Yeah.
wish it was something that was offered in our high school years. I know
Oh,
people are like, oh, that's a little bit intense, but if for the people that were curious or having more information other than it's important, contraceptive care and education is very important for the teen. But also in the same rep, being explaining what your natural cycle is. So many
right.
people get to me, I mean, from all walks of life, from tech execs in San Francisco to anyone that's a young adult that hasn't gotten any sort of education yet, beyond high school. It's like they all say like, I had no idea
Oh,
about this,
yes, of
and
course.
apologize for it. And I'm
Yes,
like,
it's very,
no.
especially those who are sort of the high-powered, well-educated, accomplished people who sit across from me and say, "How do I not know this about my body?" And I say, "How could you ever know anything unless you were taught? We were just taught, to avoid
Mhm.
sex or use contraception, but we were never taught our physiology." So,
Mhm.
now, do your webinars include that little sort of education, like this is your menstrual cycle, this is what's happening? Oh, fantastic. So
Yeah,
people
we
can,
do.
before they even call you, can get a
Mhm.
primer on what's up down there.
I know,
Yeah.
right? And really talking about like, how do I know I'm ovulating? Well, usually if you're having a regular, predictable, you can kind of point on a calendar. That's where my period will be. And that you're not on any sort of birth control.
Mhm.
Obviously, that can kind of give us maybe a clue as to this is an ovulatory cycle. And just like that alone, people are like, oh, okay.
Mhm. Mhm.
Pumping that up with fertile signs in your
Yes.
body, going beyond about, tracking it with urine tests,
Yes. Yes.
all of that. And really just, and again, it's all about empowerment through education and just
Yeah.
equipping these people to be able to be in the driver's seat of
Well,
a really
that's the entire
important.
purpose for this podcast, Health University. We call it university because the importance of of knowledge
Right.
as power it's irrefutable. You know, the more we know, the more agency we have over making the right decisions for ourselves, for our bodies, for our future. Yeah,
And I
that's brilliant.
cannot thank you enough for what you provide.
Oh,
The
yeah.
education is just phenomenal because what
Oh,
can we do without that as a
exactly.
foundation, right?
So I have a question that I'm sure is out there, and so I want to make sure we ask and address it because if someone's listening from outside the state of California,
Mhm.
let's tell them what they need to do to begin.
Yes. So, what's exciting and something that I haven't mentioned yet is that we're just the first. We're the beta. We're the blossoming of a big flower that's going to expand hopefully
Yes.
across the United States. So, we are the first site of this open model. We'll have another one in Astoria, on the East Coast, and
Astoria, New York.
outside of New York, and then another soon to come, maybe later 2026 in Colorado. And so it's expanding, and we're trying to get, again, it's all about increasing accessibility
Mhm.
on the geographical level as
Yeah.
well. But given that, I mean, Astoria will be opening at the end of this month, so there will
Okay,
be an
that's
East Coast
soon.
option as well.
So yeah, listen up,
Yeah.
East Coasters.
Yes, exactly.
Thank you for listening to this episode of Health University. We always strive to find ways to improve our support of you. Please connect with us for a fertility assessment call at the link below, healthuniversity.co, note not .com, /your fertile health call. We'd love to learn a bit about you and share our resources. Now, let's resume our conversation in today's episode.
We have a lot of telemed involved.
Mm-hmm.
Do need an on-site presence for blood work and that ultrasound and the diagnostics that we can do in person.
Okay.
Other than that, a lot of what our work together can be remote.
Mm-hmm.
Um, so yeah, it's really about reaching out and exploring what would be possible in terms of being able to travel to Astoria or the Bay Area, Roseville, or Colorado eventually, and being able to be on site for that in-person evaluation. But am I answering your
Yeah,
question?
you are. And I'm just going to repeat it for to make sure that I've
Mhm.
got it straight, so that listeners have it straight. So they show up in person for their first appointment, where they
Mhm.
have this incredible intake and evaluation, and if the timing of their schedule allows, lab work as well. So it's really a one and done. Then they go back home and continue through telehealth. And
Mhm.
does that also include, sort of future appointments or meds? Can they get their meds delivered to them in their home state, and
Yes.
then they come back for a trigger for retrieval?
Right.
Then they can go back home until everybody decides it's time to do a transfer. Is that
Right.
correct?
Right.
Beautiful.
Yes. So being able to be local, because of course, one of the ways that we're not compromising quality care is by using these state-of-the-art, high quality embryology labs. Because, of
Mhm.
course, the relationship is so important in feeling supported and met and heard and listened to. But really, that IVF magic is happening
Yeah.
in the hands of the embryology labs where they're taking place. And so for Open Roseville, we are partnered with our parent clinic, which is Spring Fertility, and our lab is in Sunnyvale. So really it's going to be coming very close to the of your cycle in cycle. What we're doing is really evaluating what is necessary. How many blood labs do we need? How many monitoring ultrasounds do we really need to have the exact same outcomes or good outcomes that we would expect? And we're learning that this can be cut back. It doesn't have to be every day or every other day. What
Brilliant.
really is the cadence, and
Mhm.
that's specific for each individual person, right? In terms of their egg count, how quickly we're going to expect them to respond, and so forth. But really just doing what we need to get good outcomes and nothing beyond or extraneous of that. And so
Mhm.
yes, you're right. So you would be coming to the area around that embryology lab in Manhattan, of course, over in Astoria, and then being local for those monitoring ultrasounds. You have your meds with you, of course, so priming would happen wherever you are home, and then coming out for those 3 to 4 monitoring ultrasounds, ending with that trigger, and
Okay.
then your retrieval being that 36 hours later. So
Okay.
we were
And then
triggering, yeah.
for people who are sort of, in California is a big state. We all know that. And then a lot of neighboring states, it really is a day. You're not having to necessarily take extra time away from, work and other commitments. You can pretty much get in and out in a day if your distance allows. Is that accurate?
For your egg retrieval? Oh, yes.
Hmm.
Yeah,
Hmm.
it's an outpatient procedure. So you would be going to Sunnyvale that morning, and you're usually there for about 2.5 to 3 hours that day.
Okay. Okay. So we talked about the journey. It starts with that initial appointment, and then what? Because a lot of this is completely, unknown to many people. Like,
Yeah,
what does it entail?
I appreciate that. So it starts with the new patient. Depending on what lab work, what are those checklist items that we need completed prior to you starting your cycle,
Hmm.
prior to your priming, meaning the synchronization of so that we're getting all of those follicles to grow together as a group. So we're optimizing how many eggs we get out at retrieval.
Hmm.
So before we can start those priming meds, we need to make sure that we have up-to-date lab work. Some
Hmm.
people, depending on, we have a lot of patients that are coming over from some of the surrounding clinics in the area, and they hear about it like last minute, and they have basically everything done, but they're like, we can't afford this. We finally met with our financial counselor. We're also very transparent about costs. You can find a full list of our costs on our
On the
website.
website. I love
Yeah.
that. I love that because then
Yeah.
somebody can actually sit down and make an informed decision and not be concerned about the element of surprise, because
Mhm.
that element of surprise in many facilities can be shocking.
Yeah,
It can sometimes double what you expect to be paying because you
right.
think, oh, I'm getting an IVF for $20,000, and then all of a sudden it's $30,000.
Exactly.
Hmm.
So you'll have an opportunity after our new patient appointment to meet with a financial counselor. That's all included in that the
Yeah.
fee at the initial appointment.
Hmm.
And you'll get to meet with the financial counselor. They'll have feedback from our discussion and what our treatment plan would be, so they can go through step by step so that you have that to for your financial planning.
Hmm.
Okay, how are we going to meet this? Because of course it's still an investment.
Yes.
It's just a little bit more insight
Yeah.
reachable.
Yeah.
And so, yeah, so to go back to your question, you meet with us or a new patient. It's a virtual consult for your financials, so that can be back in your home with them. You'll have the opportunity to meet one of our fantastic patient navigators. And so the patient navigator is someone that you will have direct contact with. You have direct contact with me or your provider as well through our messaging app, which is great. But she will be walking you step by step to make sure we have the labs.
Hmm.
And I mean, that's infectious diseases, thyroid testing, blood work, CBC. If you want to do genetic screening, that's a whole other podcast.
Right.
But
We'll
we'll talk
schedule
through,
that.
yeah, we'll talk through what that means. It's
Mhm.
basically just more info to inform reproductive choices. It's
Yeah.
never a requirement, but something that you can, if you wanted to cross that bridge, what that would be your next step there and getting that done. Meeting with the financial, meeting with the patient navigator, our care team to tell you what you're never going through this blind. It's like
Mhm.
what that next step would be.
So in advance, you're not chasing, oh my God, now I need to add more meds. It's all kind of really predetermined what you'll be using and when you'll be using it.
Exactly, exactly.
Great.
Yes, you'll have a calendar review with me where we pull up your calendar review, we go step by step, what you will experience day by day when
Mhm.
you're actually in cycle, and you go for your ultrasounds, you're monitoring ultrasounds. If I'm not doing it myself in person, because I do work remotely some days as well, you'll meet our fantastic sonographer. I'm watching in real time as the images and the sizes come up. Then we sit down and we meet virtually and we go through what we're changing, what the symptoms, how you are doing, how you're feeling, how we can address some of that. and adjusting your dosing. So every time you're having an ultrasound, you're having a one-on-one meeting with me directly right
Oh,
after.
beautiful. Okay.
Mhm.
I don't want to interrupt you. Is there more?
Trying to see if there's anything that big thing that I'm missing. Yeah, no, I mean,
Okay.
there's certain things since for specific cases.
Yeah. The 30,000 foot view doesn't need to
Right.
go into at this point because that may not be you.
Exactly.
You
Exactly.
began, we began the conversation and you mentioned, maybe I should say who this is not for.
Yeah.
Can we
Mhm.
say a little bit more of like what might be like a diagnosis or a testing or something like that, or a lab result that you would say this person probably is more suitable for, sort of traditional IVF care?
Yeah. All with a disclaimer here to say that, especially for my advocacy and my wanting to make sure before we say your care would be in better hands somewhere else, we really are looking at individual cases. But
Mhm.
right off the bat, we know because beyond 42 years old, s- the stats change so
They do.
drastically. We
Yes.
want to make sure that you get somewhere that you can go directly into more of those advanced treatment options
Mhm.
in a setting that is set up to support that and get you through that as quickly as possible.
Mhm.
Um, the BMI is really, it's all about trying to keep the person safe.
Yes.
So in terms of BMI, it's in an ambulatory surgical center. So we aren't attached to a hospital. So we're thinking about in the rare case that someone needs emergent care, can we transport them safely? And
Mhm.
so the BMI of 45 is our cutoff
Okay.
because of that ambulatory surgical
Got
center,
it. I mean,
not
I
connected.
mean, like, thank you, right? I mean,
Yeah,
these are
keeping them
precautions
right.
on behalf of the patient. We're not going to just take someone in because it's low cost and then put them at risk or put them at a disadvantage if, again, at age 40, 42 plus, the expectation would be they're going to do better with, the wider array of services in a traditional model.
Exactly,
Is there
exactly.
anybody else who,
So we aren't set up to support on-site IUIs right now. It's
oh,
something that we're hopeful as we
cool.
get more providers who can be on site every day, because
Hmm.
we never know when an IUI is
Right,
going to be needed. So we're going
right,
to need that ability to have that next day
right.
ability. But as a someone who went through midwifery training, I'm very passionate about educating people in terms of the amount of providers in a community setting who are able to perform IUIs. They're extremely trained. And so part of my work has been connecting patients with outside community providers who can do that, that are
Oh,
in
beautiful.
Bristol and Sacramento, and can even do that in their own home, which is
Yeah.
fantastic.
Beautiful. Yeah, I know there are some now, kits that you can
Mhm.
purchase. So this is a sort of down the road. I mean, at this point, I don't want to highlight it and then have people disappointed when they call you and you say,
Yeah,
that's really not true right now, but it's coming soon
exactly.
to a theater near you.
Yes, exactly. So no on-site IUI because we
Okay.
don't have an andrology lab either to process. So that's on the horizon, but currently we don't do on-site IUIs. We do ovulation induction with timed intercourse.
Hmm.
We IVF, including ICSI, PGT, pre-implantation genetic testing for
Hmm.
aneuploidy, and also monogenetic disorders, so PGT-M. Initially, we said maybe those were too complex cases for this beginning blossoming of this new model. But then we had so many patients come to us saying because PGTM and the probes involved for testing for those monogenic disorders are so expensive
Yeah.
that they weren't able to afford the IVF costs on top of that probe development and so forth.
Hmm.
And so we opened our doors to them.
I love this. I mean,
Yeah.
you really are blossoming. I mean, in terms of like it's providing what you can safely, and effectively, and not just limiting yourself to, okay, this silo, this is what we said we could do, and so this is all forever what we will ever do. You're really planning to expand into more services as the data, the feedback, the results allow. Is that an accurate
Exactly,
and
1000%. And what does this population need? I think that the population around each of these clinics, and then of course, kind of expanding out, they're gonna ask us, what are their needs? What do they need? And we saw lots of PGT-M cases that came through, and I couldn't say no. We couldn't say no. Our medical director, Dr. Menarez, we said, this is something that we can do. Let's do this. And
yeah.
so
I'd
it
love to
is,
give a little shout out to Dr. Menarez. I've long been a fangirl of hers. Dr. Deb
oh,
Menarez,
who isn't?
right, is truly has long been an advocate
Hmm.
for, making babies affordable and healthy babies affordable. So she's always worked very closely with those of us in, Chinese medicine, functional medicine, things like that. And whereas, in the early days, I've been doing this 23 years, it was a lot of times I was like, well, it's okay for stress relief, I suppose. And thankfully we now have research. We've
Right.
got the data that
Yeah.
says, yeah, it's that
It's
and here are the live birth results. So let's elevate it a little bit.
right.
But Dr. Deb has always been an advocate for for integrative model of care for the patients.
Exactly. Yeah, no, I can. Thank you.
Yeah,
That's very
yeah.
well said. And because reproductive endocrinology is a very specialized field, we work closely in terms of a collaborative care model. So as APPs, advanced practice providers,
Mhm.
we work closely with our medical directors for collaboration on running protocols. So we're having daily meetings about our new patients.
Mhm.
She has eyes on all and making those treatment decisions, really collaborating on more complex cases throughout. And so, yeah, we wouldn't
Beautiful.
be.
And so that's also how it can become more affordable, is that you're not having the medical doctor REI having to perform all of the procedures, which, they've earned their hourly rate. They've worked hard and
Exactly.
long.
Yeah, they're
And, but but if
huge.
but if they can just be doing the sort of analysis and be working with you on the treatment protocols, they don't have to be physically doing the thing, the ultrasound, in order to
Right.
have it be an effective ultrasound. So I think that's brilliant. I want to be respectful of your time. I just became, because I could talk with you all day. Is there anything that we haven't covered that you want to say? This is actually an important point that I want the viewers and listeners to hear.
Yeah, I think just on that last point is that nurse practitioners, physician assistants, they are trained in a different way than physicians are. We know our limitations though. And so in terms of the retrievals and the embryo transfers, that will always be in the hand of a physician. But we really know, because of the way that APPs are being utilized in different settings, that we can grow into this space
Mhm.
under the guidance and the collaborative model with the physician, with
Mhm.
our wonderful Dr. Menarez and future medical directors to come as we expand.
Mhm.
But really, just I know that that's a big concern as we kind of start stretching the limits of how we can work in this space. And a lot of people want to know that we're not surgeons, and we're not embryologists, and
Right.
everyone has those important roles, but we can be in that co-pilot seat with our provider, with our patients, making sure that their needs are being met in all ways. And that's really where the advanced practice provider we really are trained with that nurse model background
Mhm.
of giving information and meeting that person in every aspect.
Yeah. Well,
Well-being.
if I may, I would say you're co-piloting with both, with patient and with the physician who's leading the case, if you will. And the result of that is, the advanced practice provider's abilities are excellent. You're not getting lesser care for a lesser cost. You, in fact, might be getting better care in some areas for a lesser cost.
I agree.
So
Thank
yeah,
you.
yeah.
Thank
So I'm going to have, all your information in the show notes. I just want to remind everybody that Georgia said, there's a lot of webinars you can review first, and then you can just, reach out. Either you do not need a physician referral in order to have your initial consult. I would like to add to that, please consider if you want to have children, maybe someday, or if you have something in your reproductive, cycles that is feeling not quite right to you, reach out. I mean, we are here to serve you, but we're working for you. You need to, like, turn that ignition on so that we can drive the bus together, if you will.
Right.
Yeah. So everything will be in the show notes, and I think we will be coming back, circling back for another podcast on genetic counseling, genetic testing, because that's also a really key, important conversation that it seems so confusing, and it is confusing. Again, if you don't know, you don't know. So let's educate.
Yeah.
All right. Well, thank you, Georgia, so much for taking the time with us. Thank you, listeners and viewers, for taking the time with us. We know that your time could be spent anywhere, and we really appreciate you spending time with us because we really are here for you. And at Health University, where, as we said at the start, it's all about your education for empowerment. We're going to close off with what I always close off with: class dismissed. Hey, thanks for joining us today here at Health University. If you want more episodes like this at Health University, you can find them wherever you get your podcasts. And make sure you subscribe to our YouTube channel so that you never miss an episode. If you have any thoughts or questions, please drop a comment down below. We'd love to hear from you. Thanks for watching, and we'll catch you at our next episode of Health University. But for now, class dismissed.